Hello and welcome to yet another lecture number 34. So, this is on the role of international individuals and organizations. This is again under the broad heading of non-state players in public health and medicine in the colonial period. We already saw the role of missionaries, the role of Indian individuals, organizations and social reform movements. So, apart from the Indian individuals and organizations, Indian and European businesses in India, international missionaries and missionary organizations, there were several examples of other international organizations and individuals who had contributed considerably to either building health infrastructure or creation of awareness or other related services in India during the colonial period. So, we in this lecture will just take a few samples. So, one of the outstanding ones is the Rockefeller Foundation. This is a New York based American private philanthropy. It was established in 1913. Among its several works, one particularly related to medicine is the promotion of preventive care through practical education and awareness creation through basically public demonstration of the efficacy of various drugs or vaccines or the usefulness of using toilets and other such things. So, it's basically, so their main focus is demonstration. So, they have a global presence and operate with a global view, but with a special focus on third world countries. And also, we have to bear in mind that health had become, especially in the second half of the 19th century, health had become more and more international. So, countries could not just limit themselves to the issues in their own countries or their colonies. And so, either they had to respond to other countries or they had to impress upon other countries about the kinds of things they have to do in their colonies for the overall international unaffected flow of commerce, or to just protect their country from transfer of particular epidemics. So, that is what we saw earlier. So, the kinds of concerns and the kinds of pressures that international players, either the individual countries or coming together through the sanitary conferences and exercising pressures or using threat of quarantine or trade embargo. So, that is one aspect of the international dimension, but there's also this other dimension where international agencies or some countries themselves reached out to other countries and areas in terms of help, let's say either directly giving material or material support or knowledge support, sending their experts, other such things. So, Rockefeller's Foundation's work is an example of the latter kind. Though, as with any other such organization, there are always doubts about what are the ulterior motives. So, for instance, in this case, so when the efficacy of various drugs were tried, so one of the criticisms was that, so they're just trying those things on the third world countries, and once they get to know something of some signals of its effectiveness or otherwise, then they might stop, and then because they got what they wanted. The other such criticisms which go with any kind of external funding agency like the World Bank or IMF. So that was always there. But anyway, so our focus here is about the kind of work, the kind of international outreach as a philanthropic organization, and particularly the case of India. So, one of the things they did, okay, this is also another kind. So, also not only bringing knowledge from there or providing personnel from Europe or US, but also funding the studies of students selected from India to go to US and especially to study public health, because US is one of the few countries which by this time had started developing this particular field of public health. So those kinds of supports, and also they helped in starting an institute in India itself. So played a key role in the founding and the funding of the All India Institute of Hygiene and Public Health, which was opened in Calcutta in 1932. And not only that, so here itself we see three different kinds of helps. So one is taking students from there and enabling them knowledge-wise, then building an institute here, and also giving expertise support. So an American John Grant is actually loaned by the Rockefeller Foundation to serve as the first, from 1939 to 1945, John Grant was loaned by the Rockefeller Foundation to be the director here. And coming to the next kind of outreach, which is to provide specific kind of advice, awareness creation with regard to particular kinds of diseases, like here malaria and hookworm related diseases. So the funding basically went towards doing surveys of the kinds and range and extent of the infections, and also creating awareness among the people, and creating sanitary awareness, plus also helping towards sanitary facilities. And not only to the people directly, because sooner or later these organizations, Rockefeller's direct stay and operations would be over. So it was important to train the local personnel to be able to provide the same kind of advice, awareness. It's another kind of sanitary related outreach was by the Rockefeller Foundation, was demonstrations regarding the inexpensive and easy to maintain laboratories, because one of the important problems in India was, not only was, and it continues to be, is open defecation. So the continued efforts to eradicate it. So it started in a big way through these demonstrations with the Rockefeller Foundation. Because open defecation can lead to all kinds of diseases, starting from cholera and fecal gets mixed with water and so many other diseases. So the next is a different kind of outreach, so for which there was particular criticism. So that is experimenting with new drugs in a new context. So here, for instance, the anti-helminthic drugs were tested by giving treatment to affected people here. And yet another kind of contribution, which is a kind of a lasting contribution in terms of model. The lasting model is the rural health units, which kind of mirrored or the foreshadows of what would become primary health centers later on post-independence. So this was also a kind of a schooling for that, or at least experimenting. And in all these things, one of the claims of the Rockefeller Foundation was that even ignorant and prejudiced sections of the population would accept it. So I think the people there in the Rockefeller Foundation had not done this course. Otherwise, they would have understood that it's not just enough that things are very simple and it's so understandable and it's very scientific, rational. So there are so many other cultural and social factors so that they learned the hard way. So if they had done this course, they would have been prepared. So not to have this kind of a simplistic explanation. So that's one of the reasons that frustrated them. And so, quite interestingly, they did not work directly with the population. Of course, they did create awareness for the people and all that, but they don't straight away go and do the work over the head of the government. So that is what it means here. It doesn't engagement. It's not like they didn't come into touch with the people, but most of the work that they did was actually through the government. So whatever funding that is done, or even awareness creation programs. So unlike some NGOs we see now, so they don't straight away go. So whatever they do is through the government, most of the time using the government infrastructure. So they worked with these particular provincial governments and princely states, for instance, the provinces, presidencies of Madras, Bengal, and Bombay, and the United Province. And they were, most of them did not last more than 5 years, except in the case of Madras presidency and the princely states of Travancore and Mysore. So there were varied kinds of responses, levels of cooperation, all kinds of doubts, and so as I said, their expectation itself was a bit too much naive. They thought that the self-evident nature of their methods itself would suffice to get the job done. And also there was, on the other hand, there was also misunderstanding from this side, that they had come here to basically do the job of eradication. So as we saw, they were more, their expertise and what they wanted to focus was to create awareness, demonstrate, provide knowledge support, or at the most test the efficacy of certain kinds of medicaments and treatments. So their mission was not to be here, stay for 3 years and then get XYZ disease totally eradicated. So that kind of misunderstanding and misplaced expectation also created disquiet from the Indian side. Coming to private initiatives involving non-Indians, so we have already come across Dr. Ida Scudder, who started the Christian Medical College Vellore. But even before that, when she started medical missionary work in the south, along with the Arcot mission, so she in fact came with a lot of preparation due to some certain particular realization she had. So so she came across instances of people suffering, especially women not available. So there was a particular case where she personally saw how pathetic was the suffering when there was not medical assistance available at a badly needed time. So fired by those kinds of things that she saw, she went back to the US, was very well prepared, got trained, and of course, so she had everything. She had that the zeal, the necessary preparation, but not to the extent the kinds of funds she would need. But on that front also, she was lucky to have a meeting with a president of a New York bank, who was Robert Shell, and who very generously shelled out 10,000 US dollars, and all that he wanted was that his wife who had recently died, he wanted her to be memorialized. So when Dr. Scudder built the hospital, better hospital than what was originally there, so she named it duly after Mary Tabor Shell, the wife of Mr. Shell. So it had an accommodation of 40 beds. Another example, again, this is the American businessman, George Goodrich. So this is a different kind of a help. So more with regard to expertise. So he, along with local members of the Parsi community in Bombay Presidency, brought a small number of independent women doctors to India that included the chief physician at the Kama Hospital in Bombay. So that was a hospital for women. So the chief physician was Edith Pichi. So that's what, as I said, the help could be of any kind. So here it is the with regard to personnel, but the same person also spearheaded efforts for creating a medical women fund, Medical Women for India Fund. So in order to get the training done here itself, so what we saw earlier was he was he was taking efforts to bring people trained there, but then as you see in several cases, so once they, including missionaries, so either Christian missionaries or the case we saw with Ramakrishna Mission. So there is, in sooner or later they find out that first is either they themselves have to start hospital or they have to start a training institute for nursing or for doctors. So here also after a while, so he felt that there should be training facility available here, and therefore he started this this fund. But it did not work immediately because there are all kinds of squabbles over what would be the level of entry, what would be the nature of the course, how rigorous, what would be the duration of it, all that. But it nevertheless did some good. So it laid the groundwork for women to be allowed into a college which is already existing. This is the equivalent of the Calcutta and Madras Medical College in the respective presidencies. Here in Bombay, Grant Medical College was the first of that kind. So now, at least because of this efforts and the creation of the kinds of consciousness, awareness, interest, so the first few women candidates were admitted to this college in 1883. So another notable contribution was the one towards the establishment of the Pasture Institute of Southern India in Kunnur. So here the person is Henry Phipps, who himself underwent a lot of poverty when he grew up in Pittsburgh, but in one of those cases of rags to riches, he made it really big in business, especially shining in the emerging world of steel production, along with other well-known giant in the field, Andrew Carnegie, who in his own right, of course, was a philanthropist, funding all kinds of things, especially educational institutions and labs. So here in this case, so he actually gave up his business. So he was very happy with whatever he was able to achieve, with the kind of money he was able to amass, and he resorted full time to philanthropy. And so he was particularly generous towards science related projects, both within the USA and also elsewhere in the world. So he had a personal he had occasion to get to know the Viceroy Lord Curzon personally. And incidentally, Lord Curzon also was someone who was very proactive with regard to science, and he firmly believed that science could be an instrument of state policy. And so he was very conscious that not much was being done to tap the power and value of science towards administration, towards research, and generally. So it's not only about medicine. So generally, with regard to the administration of colonial India. So he was one who actually was very enthusiastic about setting up national centers, imperial labs and centers all over India, something of the kind that, say, for instance, Jawaharlal Nehru and Bhatnagar would do after independence. So, some kind of foreshadowing was there in the Viceroyalty of Curzon, and so it's also a great coincidence that someone like Pips met him and gave him. He's supposed to have given several thousands of rupees. So some of it actually went to the setting up of the Pusa Institute for Agriculture, so named after a place Pusa, which is now in Bihar. But of course, due to the earthquake there, it was transferred to Delhi. So, yeah, but even then, it's called the Pusa Institute, or the more officially the Indian Agricultural Research Institute in New Delhi. So, both Phipps and Curzon were particularly devoted to agriculture. So that's a side story. But coming to the Pasture Institute, so some part of the amount was allotted to the setting of the Pasture Institute, and as already we saw, there was a first Pasture Institute set up at Kasauli, but then that was far in the north and up in the Himalayas, and rabies, anti-rabies vaccine was a great requirement because as in these days, so even more in those days, there was the great problem of dog bites and related ailments. So that there was a need to have at least one in the south, and so therefore the Pasture Institute of Southern India, that is PISI, was started in Kunnur, again in hills, the Nilgiri hills. So it not only catered to the research on rabies vaccine, both its preparation and administering of it to the patients after the production through research. It also, the institute was also associated with researches on Kala-Azar, filariasis, and aspects of medical entomology. Later on, it served as a center for nutritional surveys and laboratories of famous people like Robert McCarrison and Ockroyd. Did considerable work there. In fact, one particular kind of work was on the beriberi disease, which is due to the lack of a particular kind of vitamin B, which in fact on the sidelines, Gandhi was, for instance, talking about laws of nutrition because of the rice being pound by machines rather than hand pound. But here, as part of the researches here, it was also done elsewhere, but it was further confirmed here that what Gandhi said was in fact true. Of course, they didn't go about doing it just to test what Gandhi said, but as part of McCarrison's own interest. So they found out that it's because of the removal of the epicarp, considerable damage to the epicarp in the rice. There's loss of vitamin B, that kind of vitamin B, which results in beriberi. But anyway, so those kinds of works were all done at the also done at the Pasteur Institute of Southern India, and so these kinds of works were also published in the Indian Journal of Medical Research, which also brought to the eyes, to the attention of the world, the kinds of researches happening here, which we discuss in another lecture. So that's what, so even as funds were coming in from outside, either from individuals or from organizations, there were also some benefit in terms of knowledge also flowing from outside. So this lecture just tried to give an example of a few such organizations, just to prove there's also another side of international involvement apart from pressure, and also to show that yet another dimension of non-state involvement along with other kinds of indigenous organizations and reform movements and missionaries, both internal and external. So, on that note, we will close this lecture. Thank you.